Darcy Craven is the president of Miller's Suburban and DeGraff Memorial Hospitals. His staff has been on the front line of fighting the coronavirus these past 6 weeks. Darcy, thanks for joining us today.
No problem. Thank you for having me.
Tell us what it's like leading, two organizations or two hospitals, really, that, whose staff is on the front line of fighting COVID-19.
I think the biggest challenge for us early on, we didn't know what to expect with the virus. So everything on the news, everything coming out of New York City was that this was going to be much worse than it turned out to be. Fortunately, in Buffalo, it wasn't that bad, but we had to prepare for the hospital to be overrun with COVID patients. And the governor put in a mandate for hospitals to add 50% bed capacity. Here at Suburban, we typically run 265 licensed beds, 20 of those are ICU beds. And we were able to develop a surge plan that would take us up to about 360 beds and more than double our ICU beds. So we really put a solid plan in place to prepare for a lot of COVID patients. We were running, I think, 30 ICU beds at our peak, and they were pretty much almost full of COVID patients, and that has subsided over the last 2 weeks. The med-surg beds, we never really got to more about 60% of our normal capacity, so that was promising. I think social distancing certainly helped in Buffalo, and we're seeing improvement every day now in our numbers. So a lot of prep on the front end. The staff have done a fantastic job taking care of these patients. Our biggest worry, obviously, was keeping the staff safe. We needed protective equipment, masks and gowns, and the Kaleida purchasing department did a fantastic job making sure that Kaleida had a steady stream of protective equipment coming in. Staff have had access to masks and gowns and never had to go without anything. So that was very promising. We've kept the staff safe during this time.
We're now into the month of May. We've been at this nearly 2 months. I want to take you back to, before the first positive case hit Western New York. How important was the disaster preparedness, the emergency preparedness, the drills and the planning for this? How important was that for you and the sites that you oversee?
I think it was vital. I think having access to the Kaleida resources, making sure that as a system we were all, on the same page with what to expect. That Suburban and Buffalo General being the two biggest sites at Kaleida, making sure that we had capacity to take these patients. DeGraff is really planning on the emergency department. Having inpatient beds again at DeGraff was a last resort for Kaleida, and unfortunately we never got to that point. But we did plan for that. We brought in equipment to DeGraff to make sure that if we did need to have patients in that building again, we could do that. But really, the DeGraff was focused around the emergency department and Suburban around taking care of the inpatients. But
Sure.
The planning was vital, really vital to, and especially seeing what was coming out of New York City helped us plan. But a lot of work on the front end to make sure we're ready.
What's it been like for the staff? What kind of response did they have initially? And how have you viewed their actions, over the past 2 months?
The staff, we couldn't be more prouder of the staff. They've done a fantastic job. Obviously, when we were getting going, and even still today, there's some fear with the coronavirus. It's a new virus around the world, a lot of unknowns. You see every day on the news about more people being sick and more people dying. So obviously the staff were very fearful or had a lot of anxiety initially, but they just went to work and they do what they do. They take care of patients, and we provide them with the resources in terms of equipment and staffing, and they take care of the patients. And especially in the ICU here at Suburban, I can't say enough about the staff in the ICU here at the Suburban and on the third floor where we really cohorted our non-ICU COVID patients. Those staff have just stepped up and done a fantastic job and really took care of this community.
So you talk about helping get resources for the staff. I'm sure that's just one of the things that you have to deal with on a daily basis. How has the coronavirus and the fight against COVID-19 changed your role from a day-to-day perspective?
It's really been the only focus for the last 6 weeks. We kind of, as a system, stripped away all the other things we were working on. So any meetings we had, or planning items we were working on, or any goals we were trying to achieve, those things just got put to the side, and we've been focused 100% on COVID. So really daily, it's about, again, making sure the staff have what they need, making sure the patients are being taken care of. We're all continually monitoring the patients, how many are coming in, what's the volume in the emergency room. We spend a lot of time, especially in northern Buffalo, the Williamsville-Amherst area. We have a lot of nursing facilities near us, so monitoring what's happening in those nursing homes, even getting into those nursing homes and providing some education on PPE and how to take care of these patients. So it's been all hands on deck for about 6 weeks now.
With that said, have you seen a change in patient behavior in terms of volumes or severity, whether that's in the emergency department at DeGraff or even at Suburban Hospital? What has it done to change patient behavior?
The volumes have been depressed. So I would say the emergency room volumes at both sites is about 60% of what we normally would run. We're seeing a lot fewer patients coming in for the non-COVID emergencies. So there was a lot of fear on the medical staff side that people were staying home and they were worried about coming to the hospital, and that we'd see more of an influx of patients later on. And fortunately, we haven't seen that yet. The volumes are ticking up over the last couple of weeks for non-COVID related items. And I think the message to the community is the hospital is a safe place to be. If you're out there and you're sick without coronavirus, you still need to come to the hospital. We'll take care of you. You're not going to get COVID if you come to the hospital. You're going to be very safe.
So you mentioned the community. As we wrap up here, can you tell us a little bit about what the community response has been and how they've embraced Suburban and DeGraff, and any type of message back to the community and those who have given their support to you guys?
The response has been tremendous. The amount of food that's come to the hospital for staff, different organizations have supplied food for the staff. 2 or 3 times a week we've had food delivered for the staff. First responders drove through the parking lots, fire trucks, ambulance with sirens blaring. We've had people put signs up on the drive-in just thanking nurses and the frontline staff. And I would just say thank you to the community. They've really supported the hospital and its staff, and it's noticed. The staff really take note of that and really feel appreciated. And I think all we can do is thank the community for all that support.
Well, Darcy, thank you to you for leading both DeGraff and Suburban, and on behalf of Grateful Community, thank you to the staff of DeGraff and Suburban.
Thank you.